Hello, my name is Chris, and I'm the social worker for the supportive care team at UPMC Children's Hospital of Pittsburgh. Advocating for your child is one of the most important roles you will have during your child's stay here at Children's. You will meet many providers, receive tons of information, and ask and answer a multitude of questions. At times, it may feel like you are running on autopilot. As the days begin to run together, many of the families we serve share that it is difficult to process medical information due to feeling overwhelmed and anxious. They find it difficult to stay present, challenging to find moments of joy and happiness in their day. So it's imperative that we find ways to center ourselves in our daily lives, even more so when we are bedside and juggling so many important tasks. Finding balance can be challenging when your child is in the hospital, but there are techniques that can help you and your family remain present, reduce stress, and find peace. One of the tools I enjoy teaching families is mindfulness. Mindfulness practice simply means intentionally bringing focus to the present moment without judgment. It is a way to step out of autopilot to align our mind and body in the present moment. And the beauty of mindfulness is that we can practice wherever and whenever we choose. Practicing mindfulness in our everyday activities can help decrease our overall stress level, increase our capacity for empathy, and improve symptoms of anxiety and depression. It helps us to regulate emotions and improve our abilities to recognize and experience joy in our days. When we choose to engage in mindfulness, it is important to give ourselves grace. As in learning any new skill, mindfulness takes consistent practice and time. It is important to notice and observe the things that are happening around us and within us without passing judgment on ourselves. It is common for our minds to wander from the present moment, to find ourselves ruminating over past events or worrying about future possibilities and decisions. To find our way back to the present, we must first observe that we have strayed. Then we can intentionally focus on our senses and gently bring ourselves back to the present moment. You may find that you must frequently redirect your thoughts and attention back to the present. Do so without judgment. We must find kindness and understanding for ourselves. With more consistent practice, we find that our minds wander less and our focus on the present deepens. As we become more confident in our mindfulness practice, we find more patience for ourselves, acceptance of the present moment, and the ability to let go of things that keep us from living in the present moment. Hospital rooms are full of different alarms, sounds from monitors, IV pumps, phones, and pagers. The constant sound can create an environment of overstimulation. The beeping of an IV pump is a perfect opportunity to practice a mindful pause. It is an opportunity to take a cleansing breath, to look internally and observe our emotional state, to look externally and notice how our senses are interacting with our environment. The IV pump notifies providers of a non-emergent need for attention. So when we notice the pump beeping, find a seat or a place to stand and disengage from what you are doing. When the pump beeps, take a breath. As you breathe in, say to yourself, pause, counting 1, 2, 3, as you take air into your lungs. Hold the breath for a count of 3, drawing your attention to the sensations in your body as your lungs fill with air. Feel the expansion of your chest and your belly, and slowly exhale while saying to yourself, out, counting 1, 2, 3, as you fully exhale. At this time, breathe normally. Take the time to focus on each of your senses. If you are seated, notice the pressure of your body against your seat. Observe the pressure of your feet on the floor. Notice areas of tension in your muscles. Shift your focus to your sense of smell. What scents are around you? Open your eyes and take in the colors and textures of what is around you. Is there sun warming your skin? Is the light low? Is the room full of shadows? What do you hear? Is there continued beeping or has the room quieted? Can you hear the breathing of anyone else in the room? Allow yourself to listen intently to the sounds around you, allowing the sounds to drift through the air as you observe them passing by. If you find your mind wandering, invite it back to the present by choosing to focus on one of your senses. Turn your attention inward and notice what emotions you're experiencing. Observe your anxiety, your joy, your sadness, your longing for home and normalcy. Allow your mind to observe these emotions as if they are a wave washing over you, knowing they will ebb and flow. If you find yourself engaging in an emotion more than simply observing it, draw your attention back to your physical senses and your external environment. You can choose to remain in the present moment as long as you wish, remembering to give grace if you find that your mind continues to wander to the past or the future. You can expand your mindfulness practice to everyday activities. When walking, we can observe the pressure of our feet stepping on the ground, the cadence of our walk, the rhythm of our breath. While eating, we can notice the texture of each bite of food, savoring the flavors, noticing the temperature, taking time to pay attention to the scent. Some of the families we serve have found simply stepping into a restroom to wash their hands provides an opportunity for mindfulness practice. Taking time to feel the warmth of the water on your skin, to enjoy the scent of the soap, the smoothness of the bubbles between your fingers. My hope is that not only will you use your new skills here at Children's, but that you will find ways to bring these teachings back to your families and practice together to help regulate emotion, reduce stress, and find joy in your days.